Hi, Joy. Thank you so much for taking time out of your busy schedule as a nurse for joining me today.
My pleasure.
So, first of all, I wanted to have you tell everybody, what hospital do you work at and what is your role there?
I work at Platte Valley Medical Center. It's in the northeast portion of the Denver metro area. I serve as their chest pain and stroke coordinator. So I manage the stroke programs and the heart attack programs for our hospital.
Okay, awesome. Joy, I have to tell you, I had a conversation yesterday with a good friend, and he was diagnosed with COVID back in March 21st. And when he went into the hospital, the doctors told his wife that he would not come out. And he is doing so good. He is now in rehabilitation. He's learning to walk again, and he's supposed to come home this weekend. But as we know, that's a really positive story. And there have been a lot of things going on out there that aren't as positive amidst COVID. So I would like to know, as a nurse, what have you seen and experienced yourself?
Well, the reality is not everyone who gets COVID-19 is going to wind up in the hospital or even be seriously ill. But there are a good percentage of people who do. Um, my experience as an ICU nurse, that's my main background, and in helping set our hospital's COVID ICU up, um, there have been a number of very seriously ill patients on ventilators who required just constant nursing care at points being on complete life support or dialysis. Um, Many of those, I would say probably about 50% of our patients here have died as a result of complications from their COVID experience. So
Wow.
it is a very, very serious disease. And although many people, like I said, don't come down with the serious case of it, the fact that they could spread it to people who are impacted in that way is very significant.
Hmm. Wow. So, you are one of the heroes serving on the front lines there at the hospital, and thank you for that. Everybody is so appreciative, and it's so nice to get this insight from you. Can you give us some professional advice as we move forward with this?
Um, well, thank you for saying that. My own experience with COVID-19 is I contracted it. I tested positive on April 18th. I'm still recovering from it, although I had a mild case of it. I did get it here at work as a result of taking care of ICU patients who were positive for it. Um, my advice to everyone else is, to the extent that you can stay home, keep yourselves isolated, you're going to be protecting not only other people who are going to get this, but also the healthcare workers who have to care for them. Much of what the CDC guidelines about wearing cloth face coverings when there's a potential to come within contact of people, keeping that 6 feet distance when you do have to go out for essentials, be it grocery store, pharmacy, things like that. Especially if you're feeling sick in any way, you need to completely stay away from everyone,
Yeah.
even those so-called essential errands. If you can ask friends or relatives to do those for you if you're feeling sick in any way. Washing your hands for at least 20 seconds with soap and water. When you can't do that, using hand sanitizer or wipes. Um, and especially as my role here managing our heart attack and stroke programs, if you are having symptoms of heart attack, um, chest pressure, chest tightness, shortness of breath, jaw pain or pain that goes to your arm, or in the case of women, it can sometimes just present as fatigue or flu-like symptoms. You still need to seek medical care. Symptoms of stroke are a little more kind of obtuse. In general, it can be things like not being able to speak, having weakness on one side of your body, balance issues. Those are things that are very time sensitive, both on the heart attack and the stroke areas. And so you do need to go to the ER or potentially even call 911. So I just want to make sure that people aren't
Mm.
stay away from healthcare facilities because of this pandemic when they really need to be seeking care in those cases.
Yeah, well, thank you. Those are excellent reminders and nice to hear that coming from a professional like you. Thank you so much for your time today, Joy. We greatly appreciate this.
My pleasure. Thank you.
Take care.